We're trying to understand ways to repair, regenerate, or transplant cells that can grow new heart muscle. And in order to understand how cells, for example stem cells, can turn into heart muscle, we've done research in the laboratory where we take a stem cell in a dish and we can grow those stem cells, and we can just grow them indefinitely. So that means we can grow as many stem cells as we want, as we have room to, and that gives us sort of an infinite supply of cells that we can then, using appropriate protocols, turn into heart muscle cells that actually in a dish you can see them beating. And so what our research is focused on is in part is to understand the process by which a stem cell turns into a heart muscle cell, and also how we can harness that process to efficiently get heart muscle cells out of stem cells. And another exciting advance is the ability to reprogram a patient's own cells, their skin or their blood, into what's called an induced pluripotent cell. And so that's something that we can take a piece of skin from a patient or a blood sample, and we can change those cells to become like an embryonic stem cell, like a master stem cell, which we call an induced pluripotent stem cell. And then using the same techniques that we had developed to work with embryonic stem cells, we can turn those patient-specific stem cells into heart muscle. So that's pretty exciting. I can take a piece of tissue from you, a little biopsy of skin, grow out the fibroblasts, the special supporting cells in there, reprogram them to stem cells, and then turn them into heart cells that are genetically identical to you. They match you. They're your heart cells, but now I have them in a dish. They can potentially be used for therapy for you, or they can be used to understand, for example, if there's a new drug that's being under development, and will it work for you? Well, we can test it in a dish first and see if it works, if it helps the heart cells in a dish, and then potentially develop safer therapies and better therapies using those patient-specific stem cells.